something strikes you and you'd like to put that question in the chat, I will try to keep my eye on it. If it is easily addressed in the midst of what I'm talking about, I might hit on it. If not, I will save it for the end. So we're going to talk about today is anxiety. So we know in some of the studies that we've done thus far that anxiety is one of the most common mental health conditions in adults with intellectual and developmental disabilities. So it's really our goal for this quick teaching session that you all be able to describe the signs and symptoms of anxiety, think about how biological, social, and environmental factors can impact it, and then think about some ways that you can support clients when it comes to communicating those symptoms, as well as some different basic coping strategies. So it's important for us to realize that there is an increased risk of mental health problems in adults with IDD. They're more likely to experience a lot of the risk factors that lead to mental health: stressful family situations, stigma, abuse, neglect, underemployment or unemployment, decreased or lack of self-determination, lack of supportive friendships, lots of things that we know in the whole population can lead to increases in mental health conditions. As I said, one of the most common is anxiety disorders. So when we talk about anxiety disorders, the labels that we think about there is something called generalized anxiety disorder. This is someone who has a wide range of worries about all things that are interfering with significant aspects of their life. Social phobia, this is anxiety or worry about social situations specifically, worried about how people will evaluate you, what they're going to think of you in social situations, and extreme anxiety when needing to go into social situations. There are things such as panic disorder, where folks will have panic attacks, as well as specific phobias, where folks are really scared of something specific. It could be something like shots or spiders or sickness, lots of different things that can cause that. So when we think about like, how do we identify if someone has an anxiety disorder? When I kind of think about this from a general perspective, you might see someone who's showing fear in an unusual situation. So like we tell everybody, anxiety is like a normal like thing that everybody has, right? It helps to keep our ancestors safe because they would feel uneasy and need to run away from the bear that was chasing them or in an unsafe situation. Even today, anxiety can help us to get the things we need to get done. It can keep us out of unsafe environments. The problem is that when it becomes disordered, it becomes over the top. It's no longer just something that's a little bit of a warning, but something that ends up having someone having extreme fear in places where maybe it isn't adaptable. It's not helpful for them to have it. You may start to see them being kind of like nervous, worrying about stuff. What's going to happen? I don't know about this. I don't know about this. Seeing some of these things happen over and over again, and also taking up more of the day. Yes, if I'm going to a brand new doctor, I might be a little nervous, especially if I'm an adult or someone with an intellectual disability that's never been to this doctor before. But if they are worrying about it every hour of every day and it's taking up a lot of their time, these are what we think about, those cognitive symptoms that are going to be a concern. Also think about things like physical observable symptoms. So someone who's having difficulty sleeping, we might want to really look into whether anxiety might be something that's keeping them from falling asleep or going back to sleep if they wake up. You might see someone being really just edgy, restless, not able to relax, shaky, their voice is shaky, their hands are shaky, excessive sweating, may not be able to voice these things that I talked about here, but saying words like I'm afraid, afraid, scared, afraid, extra shouting, trying to really escape or withdraw or freeze in an unfamiliar situation, and maybe showing irritability, which sometimes isn't something we think about with anxiety, but if someone is worrying at all the time, they might start to get that irritableness. Think about what that excessive worry can be about. Things coming up in the future. So if they're worrying about the banquet they have to go to for the County Board of DD awards, and they're worrying over and over and over again and over again, worrying about something they did in the past, a mistake that they made, worrying that something bad might happen to their loved one, worrying about storms. So again, we're in Ohio and it's spring tornado season. So if there's a tornado warning, maybe it makes sense to be worried about it. But if every time the wind blows, the person is very worried that there might be a storm, or they're worried to leave the house if they see the weather report has rain in it, these are things we want to start to keep an eye on, being worried about social situations. So what can providers do? You guys spend, and those that you supervise spend the most time often with an adult. You can see changes in behavior. So if you see someone that seemed to be going okay, and all of a sudden you're hearing more of this worry, you're seeing some of those physical symptoms, you're listening to them and hearing some of those words about worry, scared, maybe start to kind of track what's going on. How often is this happening? When is this happening? And then it can be really helpful to work with that individual, with their team, and to look into stuff, and then maybe making a referral for a specific mental health evaluation. We know there are a lot of treatments, both medication as well as therapy, that can help folks with developmental disabilities and anxiety. I see Christine saying sometimes shaking and rigidity can be a symptom of spasticity or cerebral palsy, not anxiety. That's a really good point, Christine. I think that's where that change from baseline is important. If you have someone that doesn't have one of those diagnoses or hasn't had maybe a shakiness in their motor movements and all of a sudden they become shaky, you're hearing it in a different way, that's when we would be worried about an anxiety disorder. Whenever we think about a mental health condition, we want to kind of try to think through what we call the help model. So we want to think, is this a psychiatric disorder? But we might also want to we want to think about, is there a medical condition? So that's a great also example of Christine. Is there a medical explanation why they're shaky? Maybe it isn't that they've always been shaky, but they have a diagnosis recently of Parkinson's or something. So is there a health condition that we need to address? Are there environmental issues? Is there a problem with the support person? Has there been a change in support people? This might not be a disorder. It might just mean that the person needs a little bit of support in this area. Are there life experiences that are going on, such as a loss of support, or anything that might, the loss of supports, a life event, trauma that needs to be addressed? We're going to talk about that at a later session. These are things that need to be addressed in the moment before we look at thinking about the diagnosis of that disorder. So what does that look like in real life? So thinking about health concerns, we want to think about hearing, ear infections, GI distress. If you're constipated, you can be irritable. You may not want to go out in public. Dental concerns, urinary tract infections or menstrual cramps, thyroid dysfunction, seizures, vitamin D deficiency. These are all kind of baseline things that we want to make sure that physicians have ruled out. And often, things like a urinary tract infection can go undiagnosed and cause lots of dysfunction in folks, especially for folks that maybe don't have the spoken words or the ability to have that communication of those physical symptoms that somebody else might have. Talked about those environmentals. So it's changes in support. The other thing to think about is, hey, are the expectations for this person appropriate? Does the team have a good sense of what this person's goals are, where their skill set is, so that they're making appropriate expectations? If all the expectations are inappropriately high or inappropriately low, someone can really experience some mental health impairment. As well as, do they have enough activities and social connectedness? Already kind of hit on this. I think one of the other things to realize is that research does show that folks with developmental disabilities are at a significantly higher risk of having adverse childhood experiences, as well as being victims of abuse or trauma. So definitely something to look into if someone is having a change in their behavior. Okay, so we talked about these supporting pieces, right? So identifying those changes in behavior, looking and thinking through that help model, the more that you can do that as the person that's tracking data and is with them and watching sleeping and eating, the better that can help. Being supportive with the referral. Maybe it's that the person says, I think I need help, and helping to support them to realize that there are treatments out there. And then often you might be asked to assist with transportation, which means you might be sitting in on visits if the individual feels like they want that support person there. So you might be assisting with transportation, but get pulled into something else. The other piece that providers and support staff can really help with is being involved in therapy. If the individual gives permission and talking with clinicians, they may invite you in for some of therapy because often in that therapy setting, we teach skills, but we need them to generalize so that we need people to practice them in other places. Just like sometimes I need a reminder to do things. Our folks with disabilities going through therapy might need a reminder to do their homework, which we'll talk about what that might look like in a little bit. But just having someone there to help reinforce it, maybe the last 5 minutes of therapy to just get a little bit of a briefing about what's going on. Maybe for someone who has social anxiety, going in with them at the beginning just to be a supportive person for them and then leave them with the therapist. So just important things to be thinking about how providers can definitely help support folks in therapy. Another really important way that providers can help is by encouraging and modeling activities that can help with anxiety. So I want to kind of have you think about, I know people have differing levels of how comfortable you feel with stuff, but I think the more that we can work on things ourselves and model and normalize, like taking deep breaths or using different apps, these can help you help yourself, frankly, because that's also one of the things we know, helping yourself with your own mental health. And we talk about self-care in about 2 or 3 sessions, I think, can help. But it also shows that person that this is an okay thing. So one of the really easy ones that I like is what's called equal breathing. It's this whole idea that we breathe in for 4, we breathe out for 4. It's this whole idea of just slowing down in the moment. And so often these are things you can do to prevent anxiety even. So if you just kind of mix it in throughout the day, but it can also help in those moments when someone is anxious. So let's see, we still got a little bit of moment. I'm gonna walk everybody through it. If you feel like you would like to practice, and I encourage you to, we're just gonna do equal breathing twice. Okay, so just like sit for a moment. And what I'd like you guys to do is breathe in 2, 3, 4, out, 2, 3, 4. Breathe in, 2, 3, 4, out, 2, 3, 4. One more time. Breathe in, 2, 3, 4. Breathe out, 2, 3, 4. This doesn't take a lot of time. If you reach, that's just a nice way to, like, I always say, like, sometimes anxiety is like this pressure cooker that's building. And by doing that breathing throughout the day, you can kind of relieve some of that pressure. There are tons of great visuals, even if you just Google equal breathing to show someone. You can talk about smelling the flowers for 4, blowing out a candle for 4. There's a lot of great concrete ways to use this strategy. Um, I put some apps in here that are also great. My personal favorite, which is free and has lots of stuff, is Insight Timer. It has a lot of different types of breathing and other things to walk you through. Oh, and I see another one. Ryan has another one called Trip that's relaxing and guides meditation. Yeah, so these are things we know that mindfulness is great for folks with developmental disabilities. Another great one that I like let's see, do I have time? I will just kind of briefly walk you through is something called Soles of the Feet. So this is a mindfulness activity that we have seen decreases verbal and physical aggression in adults with ID when we walk them through it. So the whole idea is we have them practice this when they're not angry, but we have them think about an angry moment, and then we tell them to, if they're standing, stand in a neutral sitting. If you're sitting, sit with the soles of your feet flat on the floor. Think about an incident that made you angry. Stay with the anger. You're feeling angry. Let them flow, those anger feelings. Your body might start to show that anger. Now I want you to shift your attention to the soles of your feet. Slowly move your toes. Feel your shoes covering your feet. Feel the texture of your socks, the curve of your arch, the heel. If you don't have shoes on, feel the floor or the carpet and keep breathing. It's really short. It's very concrete. You can even put a little sticker on their foot if we need to remind them to look at it. But it's a way to reset your own mind and or our clients' minds away from that anxiety or that anger provoking thing and move it into something that is a bit more calming. So there's great, I have on here, I have the YouTube videos that you can look. If you even Google soles of the feet, you'll see the script that I just read for you that can be something really helpful to practice with folks. So with that, I am done and I'm going to open it up for questions that anybody or comments that anyone has before we move into our case discussion. What thoughts, questions about anxiety, clients that you've had where you've tried to figure out what's going on? Christine, do you have your hand raised? Yep, go ahead.
Sometimes the other thing that people have used is this frisbee, like you're wanting to get rid of the certain anxiety and you're like hitting it like get out of me.
Yeah, it's
It's
a nice kind of like way to, lots of different ways to get your
yeah,
emotions out. I think
I'm just
that's a,
saying that's a that's just something some other people do. Uh but
yeah,
there's a whole, if you guys go onto the app store, there's there's so many mental health apps, and I think there's one for anxiety.
yeah, yeah. And it's kind of always a little tricky. We never know if the apps and what's out there is like what we call evidence-based or supported
Right.
by research. So I think, but we do know that apps that help with breathing, apps that help with mindfulness activities like soles of the feet. There's another thing I didn't have time to talk about called progressive muscle relaxation, which is all about tensing and releasing, is another one of those evidence-based strategies. I see Ryan has a question. Can severe anxiety cause exhaustion? Yes. So that could be something, extreme fatigue you would see often in folks that are just saying I'm tired, tired, saying they're tired all the time. If you kind of like put yourself in their shoes, if all of these anxious thoughts are moving through their head all the time, they're physically tense and tight, that's exhausting. So that might be one of those ways. If you see someone that's saying they're tired a lot, sometimes we think about depression, and I think that would be another important thing to look into, as well as in that help chart, any medical explanation for tiredness too. So I think, but definitely something to think about. Yeah, Cindy's saying a counselor or psychologist would be able to recommend an app. Yeah, and that's a great suggestion, Cindy. So if someone's working with a counselor, they'll kind of know what their treatment plan looks like, and then often we'll pull in some of those good visual supports. Cold drinks will ground them. Yeah, something. I think that's one of those things where you want to work with the individual to think about what would work with them, what helps you get out of your thoughts and into the reality, acknowledging their thoughts, but moving on to what's going on around them. Any other thoughts or questions? Oh, yeah, Jane, this is a great point. Jane's saying they makes box breathing stickers in different designs that can be handy for deep breathing practices. Easy to stick them on anything, take them along, your water bottle, your iPads. Yeah, I think it's great. I also heard someone say, we have squares everywhere. So if you can even kind of think about like, iPad, yeah, if it's on the back of an iPad that the person's keeping with them all the time. But as a phone, the screens, there are lots of squares, so that's everywhere. Yeah, Ida is saying sleep can help regulate mood and stress for sure. So I think that's another one of those pieces that we know that when someone is not sleeping well, it does impact their daytime behavior. And mental health can impact sleep, but sleep can impact mental health. So I may sound like a broken record at this point, but again, thinking about, well, why are they not sleeping? Is there a medical reason? We know that there are specific medical things such as low iron and other things that can cause folks to not sleep. Or is there an environmental factor that they're not sleeping? What's going on with their roommate? Are they sharing a room? Is it loud? So thinking through some of those things can be a really important first step. Um, Exercise. Yeah, so that's kind of that activity, that connectedness. Cindy, I love you guys all coming up with some great ideas. All right. If there's not, feel free if you think of questions, you can go ahead and put them in the chat. But I think at this point, I will hand it over to you, Cody, and you can take